UK Healthcare Community Connection is sponsored by UK Healthcare.
We're happy to have Dr. Benjamin Wilson from UK Healthcare Sports Medicine with us in studio this morning to discuss a common injury in sports involving the ACL.
Ooh, long recovery process. And unfortunately, ACL injuries in young athletes are on the rise. Why do you think that is?
Yeah, it's unfortunate. It's one of the alarming trends that we're seeing in sports medicine is that the number of ACL surgeries that we perform, especially in kids with open growth plates that are still growing, has continued to rise. I think it's part of the culture of sports medicine or sports here today is that kids are more and more competitive at younger ages and may not quite be coordinated or strong enough to face the demands of the sports that they're playing these days.
When it comes to the treatment, not only during the surgery, but the rehab as well, doctor, how does it differ from a child to an adult?
Yeah, exactly. So understanding why it's important to make that distinction, you first have to understand how we treat ACLs in adults. In the ACL, it's the main ligament in the knee. It stops the tibia bone from shifting forward and rotating. Unfortunately, it doesn't heal on its own. So if we sent kids back to sports with a torn ligament, they would end up not being able to do the sports that they wanted to do, but also doing more damage, like tearing their meniscus or injuring their cartilage. When we see an adult, we can't just stitch the two ends back together. We've got to remove the torn ligament and replace it with a fully formed ligament that we get from somewhere else. Now, when adults, to do that, we drill some tunnels through the bone. We fix it in place with either metal or plastic screws and buttons. And the problem with our kids is they've got two major growth plates on either side of the knee. If we were to do that, we could injure those growth plates and cause a difference in the growth or the angle of the legs. So when it comes to kids, we have to figure out how we can do that, but give them a stable knee, but still be safe in respect to their growth plates. So to do that, we have to know exactly how much growth each kid has left. So if you spend any time around middle school or high school age kids, you know that there's a wide spectrum of maturity for each age group. So every kid that comes into our clinic gets a thorough evaluation, both an x-ray of their legs to make sure that they are even and not too knock-kneed or bow-legged, which can cause some risks, but also an evaluation with some x-rays of their hand to make sure we know exactly how much growth is left so we can tailor and individualize the surgery to that kid and reduce the risk of injury to the growth plates.
Is there any certain situation where after a diagnosis surgery is avoided?
So that was a thought. Historically, surgeons would say, hey, let's stop you from playing sports. Let's hold you out for a year or two until your growth plates are closed. And what we found is that realistically, life is a cutting and pivoting sport for a lot of our kids, and they run the risk of doing damage to their knee, further pivoting, shifting episodes, even on the playground, around the house, running with kids. So we tend to encourage earlier surgery, but still being safe within the context of the surgeries that we do.
Well, thanks for all you do. Obviously, so important getting people back on the field, whatever sort of field of play that they're involved in, or just everyday life, doctor. It's so important.
The sport of life. I like that you mentioned that. We appreciate you being here. We'll have our final half hour of the newscast after the break.